Welcome, dear viewers, to today's episode of Visite. Thank you for all the valuable and interesting letters and inquiries. And I understand from it how important it is to get a second opinion, to get and understand medical advice from a holistic point of view. And I think everything you know will make you calmer in dealing with the things that you carry, that burden you, or maybe help you with ways you are looking for to get out of the disease. And maybe I can go straight to our first sender. That's Andreas. Andreas found out in 2019 that he had severe renal insufficiency. As early as April 2019, he was told that only 30% of the kidneys are still working. Now it is only 10%. And he's been on dialysis for 4 weeks. Of course, a severe restriction in kidney function means a disaster for our body. Our body relies on its main detoxification organs, such as the intestines, the liver, and above all the kidneys, that they complete their job caringly and mindfully. That means whatever the liver prepares in terms of a fat solubility to a renal passage must then be discharged through the kidney. These are, of course, a large number of metabolism's own end products, like urea, creatinine, our muscle protein, uric acid. These are things, if they cannot leave the kidney, with uric acid you can judge that with gout, there is insane pain that can be suffered when such uric acid crystals crystallize in the body. Oddly enough, this happens a lot in the big toe. But I think the question Andreas asked me was a second opinion, and I know little about him. I don't know anything about his life. I don't know anything about the causes. And now I think the dialysis approach is valuable and he is getting much better. But you have to learn to understand the causes at this point. And I want you, Andreas, and maybe I would like the viewers, to pay attention to it now. What you have to use before you are, of course, registered for the transplant, and the damage caused by kidney failure is very great. But I would like to ask you to investigate the following questions. The first is, we also see in kidney disease 70% are due to a tooth and jaw problem. There is no way around it. Please visit a holistic dentist now who looks at the teeth, either with a panorama picture where all teeth are depicted, or also a DVT, that is a dental tomography, which shows exact structures at the roots or transition from tooth to jawbone. You can discover foci of inflammation there, and these are all spreaders of infection. But very many people have pivot teeth in the anterior region. They have dead teeth from accidents. And the consequence of such a problem is the loss via the bladder-kidney meridian. The bladder-kidney meridian runs from top to bottom. It starts on eye level and pulls down to the little toes. The great energetic pathway has a huge impact, including the function of our bladder, kidney and prostate in men. Therefore, you must always keep in mind if this kidney and bladder meridian is weakened, for example through dead teeth or pivot teeth or focus events, then the kidneys will only have to get by with a corresponding fraction of energy. That means you challenge them every day to give 100, 120, 150%. and they are energetically incapable of doing so. This must have long-term effects on the kidneys. I was able to experience this myself with a patient who was on dialysis and as a result no longer had to go 3 times a week but only twice. And that alone, regardless of the many other things, has changed the energetic function of the kidney. A kidney can only work 100% if it can produce the energy itself, and the energy has to flow. I also ask you now, where you might think all is said and done, that you should really put the focus on diagnostics. So the first is a holistic dentist. The second is that the kidneys get involved in the big topic of detoxification. And now I don't mean detoxification of your own metabolic end products, but now I mean what we are all subject endure in this daily life. That means you don't live somewhere on a star, but you live here in Austria. And you certainly have a far more privileged situation than perhaps someone who lives in a big city or near the airport. And yet I have to tell you that everything we do not recognise and what we do not see is a burden. That means in the context of a reduced discharge, a very big problem can develop on the other side, namely that the kidney absorbs toxins. When talking about kidney diseases, there are 3 really big toxins. One is mercury. The mercury in fish is actually less stressful for the fish because the fish is rich in omega-3. However, we humans, we ingest the mercury, and when the mercury turns into dimethyl mercury in us, then this dimethyl mercury is, after plutonium, one of the most toxic heavy metals in the world. Please do not underestimate this and look for such exposures in your body. Of course, you can do that to a so-called heavy metal test, a LIGO scan, by analysing the heavy metals in the connective tissue. You can also filter the urine itself and examine it for toxins. Of course, one can filter out the metals in the context of kidney failure in a fairly restricted manner. Yet in my great and wonderful cooperation with our resident specialists for heavy metals, Dr. Joachim Mutter, he and we even succeeded in chelating people with high renal insufficiency, because the kidney thanks us, because the kidney frees itself from all these things that it has stored away, and mercury is a cell destroyer. We don't see it, we don't hear it, and I wish and hope you don't have anything left in your mouth. But when you have it in your mouth, and I can see that you are in your mid-50s now, then you have to pay attention that you should, of course, undergo a major renovation here. Also with regard to not burden a possible new kidney with it again in future. Mercury has a very toxic effect on all protective enzymes. And you know that protective enzymes, or enzymes in general, are biocatalysts. That means our body cannot carry out reaction A to B, a biochemical reaction, if the appropriate enzymes are not available now. This is where toxic metals intervene. And that, for example, apopectin and all the solvents or binding agents for mercury bind these things through the intestine, also binding zeolite and discharging it. That's out of the question. But in your case, the discharge has to be done very carefully and thoughtfully, if at all. But this is not about discharging. This is really about diagnostics. The second is cadmium. Cadmium has a so-called nephrotoxic effect. So cadmium as a heavy metal is present, for example, in car exhaust. And cadmium has a far more toxic meaning than mercury, which can completely damage the kidney tubules and also the kidney cells. So a high load with this metal even leads to the development of tumour diseases. That's why I have to keep saying about cadmium that people who smoke or smoke passively, we are talking about high exposure to cadmium, also in car batteries, in plastics. I think you can just Google it and you'll find everything you need to know about cadmium. And the same metal doesn't do the same thing at all to different people, because the body may be better able to expel these things. And maybe they don't have an interference field problem in the tooth and jaw area and always draw on 100% strength. So in the development of such an insufficiency, you always have to assess everything at the end and find the way out of it. And the other one is lead. Lead also has a high toxicity, especially when the kidneys are burdened. Lead in cigarette smoke anyway, but also all the hobby hunters. Lead is also, this is addressed to mothers, seen in public playgrounds. And we say today that the kidneys, as well as the bones, absorb 100 to 1,000 times more lead than about 300 years ago. And that is a burden that cannot be assessed at all. We, who are 50 and 60 years old today, of course, also had a childhood where the cars were still lead-fueled, and such heavy metals have half-lives for years or even decades. Do for our blood to always remain in good health, and the body serves the blood. It stores it. It stores it in the connective tissue. It stores it in the kidney and the liver. And you can't get tired of showing people again and again their responsibility for themselves. We live in a time where these burdens, for us humans, are normal, and the wheat is separated from the chaff, who, of course, has a lifestyle on the one hand, with a conscious exposure to pollutants, let's say, who handles them very well and avoids them. I mean smoking, I mean eating organically, I mean dealing with life, of course. But on the other hand, we can't all be living under a glass dome. We did an episode with QS24 on ionospheresis. The ionospheresis, for example, is a dialysis that helps the body detoxify all those toxins through a special environmental filter. If you please Google, or if you go to the channel, you can also get detailed information here. So I'm bypassing the kidneys here. Here I can directly filter out toxins such as heavy metals, light metals, solvents, also high bacterial endotoxins, also inflammatory immune complexes. This is a great alternative to initially relieve the body as a whole. So the first thing is the teeth. The second is, please look for toxins. The third thing that is important to me at this moment is that we're talking about phosphate. Phosphate is an indirect balance to vitamin D and calcium. The phosphate household is managed via the parathyroid hormone. And phosphate is 85% in bones, but also 14% in our body cells. And phosphate is incredibly important because phosphate regulates, for example, the energy balance in our body cells. That means phosphate is involved, that the mitochondria are energy power plants, which must be looked at now, please, because when the energy power plants of the kidney cells, the so-called mitochondria, develop a mitochondriopathy, and such examinations can of course be carried out by measuring the so-called nitrosative stress, then the performance of the kidney cells declines. And that load of, let's say, very toxic substance may also be caused by too many light drinks. Phosphate is contained in coffee whitener. We have phosphate in powdered milk, in sports drinks, in milk beverages, in soft drinks. Then, of course, there is an oversupply of phosphate, and that's what the body can't stand at all. So all of the 338E substances, for example, which contain this phosphoric acid, are very popular in the food industry, but damage our organism because they are causing a balance and equilibrium. This is called homeostasis, to become unbalanced. And the kidneys with their kidney damage are, of course, due to the high content of phosphate, let's say unbelievably strongly damaged. There are many others. When they Google for phosphate, then you'll find magnesium phosphate, sodium phosphate. So there are a lot of the so-called E additives, which contain a great deal of it which the food industry needs. And right now I'm reaching for a book right here by Hans Ulrich Grimm, The Soup Lies, The Beautiful World of New Food. You lose your faith when you see what is going on today in the flavour industry, with flavour bombs, with really absolute, you could almost say, scams of our taste buds. For all this sensitive information that continues through the tongue as receptors, which control the liver in its preparation for digestive enzymes. And the stomach, this is so misdirected, this is so misguided, and it opens your eyes to the fact that you will pick up some food in the future and just look at it because of the nomenclature and the E digits and say, I never want that for myself. That my body has to live with these burdens in bread alone, in conventionally bought bread. Around 200 additives are incorporated in addition to grain. And they are so ingenious today. You can smell the bread. You can smell it for hundreds of meters. And it leads you right there to such a bakery. Now, all of this is only livable and compatible for our body to a limited extent. So please also search for environmentally toxic things. And if I come back to the inospherosis, you can, of course, have the eluate, which is then filtered out via the plasma, examined to maybe get an idea about the neurotoxic or nephrotoxic, so kidney toxic toxins. Of course, that also makes a good diagnostic tool. The first were the teeth, the second are the metals, the heavy and light metals. The third, of course, are also the things we know today, that there are a number of parasitic loads that strain our kidneys, that are attracted to the kidneys and to many other parts of the body. Don't underestimate the fact that parasites are freeloaders. So the parasite will never reveal itself to you in any way. Parasites have their own life cycle. Parasites speak the language of hormones and neurotransmitters. Parasites even intervene in the tumour process. And parasites such as blood flukes also have a high impact on kidney health. Schistosoma is the name of the blood flukes, and there are a number of different leeches. Today, we say worldwide that over 250 million people are infected with these schistosomes, with this leech, and via the bloodstream and then via the lymphatic system. Via the lungs and liver, they also get into the kidneys. They cause a lot of problems, from allergies to headaches, via allergic reactions, nettle rash. The picture of such a parasitic load can often look allergic, but also rheumatic and inflammatory due to the pain in the limbs. And somehow, one cannot recognise the real cause of it. So genitourinary schistosomiasis is really to be ruled out. Now the diagnosis of parasitic loads is actually medically not so easy today, because we don't really recognise the seriousness of parasites in everyday life. We use a stool sample for this purpose, so we ask for a stool sample 3 days in a row, but also examine them again specifically for roundworms, eggs and larvae. And if this stool sample contains nothing in this regard, then the parasite diagnosis is almost complete. There's one more laboratory value, that's the eosinophils, which can be formed in a differential blood count, and that is perhaps also a secondary indication of a parasitic load, but not the main indication. So in 80-85% of the time I experience that, even that doesn't lead me to there. That is why it's so important that you can maybe turn to someone now who has experience in parasite diagnostics in order to ultimately help you here. To further clarify these things, and also the toxicity, you can be contaminated with heavy metals. You can be burdened from the tooth and jaw area. And maybe because you have maybe been abroad. Because you live in nature like you do. You can be infected by so many things. That is beyond the scope of this now. I just wanted to make you aware of this with this example. That with a salvia test, or bioresonance testing, you can actually get to the bottom of this question. And then, of course, should treat these parasites with frequency therapies, but also with antiparasitic therapy. As part of the answer, I believe I have now given you a few impulses. Of course, there are many more things that would be important here, but you should really set off and not waste the time. Maybe also to give your kidneys another chance. That the kidneys can also, let's say, recover and regenerate. You are not yet 70 and not 85. And in that moment, a doctor can look back on a great deal of experience. We are all aware of our huge responsibility here, and what a blessing this transplant might give. But it would be already a blessing if one could perhaps investigate the cause of the kidney problem here and could improve it in the long term. It must always have been a chronic latent inflammation, because inflammation destroys. Inflammation can, of course, reduce energy output, and all of that now needs to be looked at. so that you yourself can contribute a lot in this process to get well or to give the kidney a chance. Well, I think there is still some time, and I might like to use the time to answer a second question. And if I answer this question, then I am happy to do so, because Urs is waiting for this answer. He is the son of a 91-year-old mother. Overall, mother and father are in good health and are satisfied. And yet he turns to me with a question for the mother. Who has a peripheral artery disease. And a peripheral artery disease in the legs would mean that via the arterial system, that is via the vessels that carry the blood to the feet, there is a temporary disorder, and it is profound. When the foot or the cell is no longer supplied with sufficient nutrients and oxygen, there is, of course, dramatic pain. As students, we learn that we are talking about intermittent claudication. And this intermittent claudication, these are the people who look very interested in the shop windows, because they just have to stop. And in the context of this, let's say, partly severe circulatory disorder, they get relief again and again. You have now listed the medication your mother takes, including aspirin, of course. You shouldn't change anything about this acetyl-salicylic acid either, because the acetyl-salicylic acid prevents the platelets from clumping together. This is purely materialistic. But you definitely don't take this aspirin away. You just have to be aware that it is another acid and an organism that has gotten into a peripheral arterial disease. Must now also be looked at how healthy is its acid-base balance. And please also at the age of 91. But because what is crucial is how is the microcirculation? And when the microcirculation, so the blood flow in the very small vessels, the capillaries, would be a highly intact blood flow, then it can compensate for a temporary circulatory disorder in the large vessels. And so, I would ask you that your mother gets a DART field examination done by a naturopath. A DART field examination that tells us how the blood flows. Because when the blood is in a great stagnation, so when the red blood cells, these are the oxygen carriers, when they also reach the foot with ease via the capillaries, then you can compensate an incredible amount for the time being. And evaluating the activity of those red blood cells is a priority now. Even with all circulatory disorders, Professor Enderlein always speaks of the involvement of the mucorrhesmosis, which is a fungus which is only developing when the body changes its environment. And there's nobody that I treat who does not receive a basic therapy in this regard, to open up the microcirculation. It is not a problem if you do not eat anything for a few weeks. It is also possible that you do not drink anything for 3 days, but when the cell is in need as part of its own oxygen maintenance, if oxygen does not reach the cell every second, then the cell has a problem. It changes into an anaerobic, no oxygen state, and that causes the inflammation, that causes the pain, that causes the openness of an ulcer and a wound healing disorder. I don't even want to discuss the extent of this now. I just want to say, open this microcirculation. It makes up 77% of our body. Try, for your mum, that around this area of the occlusion, new collateral vessels open up, supported as good as possible by movement. And even at 91, even if it's painful, you should never get tired to let your body know again and again that it is needed, that the blood flow is wanted. Brush massages are very important here, which of course can go down with a certain pressure, but go up with more pressure. Also include the leg, make foot-based baths too, or simply with Himalayan salt or sea salt. That regulates the microcirculatory problem. I think if you just Google Kleinschwilst, you will find it right here on the channel QS24. There are also these magnetic mats. This is also a wonderful alternative to stabilise the microcirculation. I would also ask you to remember that right spinning lactic acid, that is sauerkraut juice, that is, for example, organic apple cider vinegar, these are all things that activate red blood cell activity immensely, and thus, of course, better supply the blood circulation with oxygen at the cellular level. I personally have experience with hematogenic oxidation therapy, and I can just tell you, whenever you draw blood from the patient, that is no more than 80 to 150 millilitres, it is then made incoagulable with sodium citricum for a short time, and then photobiological oxidation stages are used to produce active oxygen, extracorporeally, so carried out outside the body. And then the blood is passed through a small cuvette along UV radiation at 253.7 nanometers. And then it is this UV light source which actually triggers such a physiological reaction cascade and restores homeostasis in the blood. The red blood cells get an unbelievable activity to infiltrate the microcapillary area again, to bring all the biological control loops that it also needs, with a certain gentleness, but intensity, back into regulation. It's like a spark plug effect that's going on there. And I've just experienced that in my nearly 30 years. It is only important that you know a series of hematogenous oxidation therapy is started at the beginning with 10 sessions, which is split up in 2 to 3 times a week, and then it is very important that you create this foundation in the beginning. Every hot has a long-term effect. My experience is that with this severe chronic disease pattern, that the interval between the hot can then be set to weekly, every 2 weeks. And I have treated a lot of people, also with these types of diseases, who actually then got such a treatment every 4 weeks. And I was always able to regulate this process again and again. I think these are a few thoughts I would like to give you for your dear 91-year-old mother. May she benefit from it, because I know how painful these things are too. When you are still fit, when you want to discover life, when you're grateful for being together, as I could see from the beautiful picture you sent, then I think it's nice when you have a son who cares so much and searches ideas, thoughts, that someone may still be able to add to this process. And with this in mind, I wish you all a wonderful week from the bottom of my heart. And my motto is always, first do what is necessary, then you can do what is possible. And at some point, you will create something impossible. But it's not all in your own strength and in your will. It is because of how patiently one accompanies the body. It doesn't want to be stressed. It doesn't want to be rushed. It wants to be guided and dedicate itself to this situation every day. Believe me, sometimes things happen, and I sincerely wish that they do. I'm looking forward to next Sunday. Goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.